Right. So Dr. Steve Whittaker is a consultant and global health investigator with specialization in biomedical design, exposure risk assessment, community and regional research, including but not limited to climate change adaptation, interpersonal violence, nutrition, body image, and education. In addition to his commitment to STEM advocacy for aspiring scientists, he has supported local projects as well as post intervention analysis for public and private entities and across non governmental projects in the Caribbean. So, Steve, this floor is yours.
Thank you so much, Avian. Greetings to everyone everywhere. I have many hats, but today I want to specifically focus on the continuum of learning that we're all kind of doing with regard to cancer care and cancer response in the region. I'm very grateful to be among a lot of very expert and experienced persons, and I am particularly grateful for the presentation that have gone before me that touch on some of the topics and or interests related to the topics I'm gonna kind of try to contain in this 5 minute presentation today. So I want to acknowledge, of course, my co-contributors and authors on this, Gabriel Myers, who's also part of the Scientific Technology Research and Work Study initiative in St. Kitts. We do a lot of the research that otherwise might not go well, would go undone to some degree because, as we can all appreciate, there are a lot of gaps in investigations and there are lack of resources when it comes to research in the region. I also want to acknowledge Christelle Nauranye and Nafisa Hussain from McGill University, who visited and contributed this past summer to some of the groundwork in the Catholic Regional Initiative. And shout out to Joran Dolphin, who is a master's student well, actually, he's now a research specialist at the Biomedical Research Foundation, where I'm a director of research operations, and he has extensive technical experience and background in cancer response from a medical point of view. Again, I'm very grateful to all those persons whose voices helped to shape what I'm going to say today. So a little bit of background, I'm actually going to take it a step out of the clinical context and talk about what happens on the ground. And so this was initiated by a 2024 awareness campaign that was launched by our Prime Minister himself, a physician, Dr. Terence True in St. Kitts. And he was more or less sounding a call to action to respond to the increasing incidence of cancer in the Federation. This, while encouraging, felt a little too familiar for me in that I think in my 41 years of life, I think I've heard different leaders and community experts, physicians, etc., kind of have this similar call to action. And if we're extending an invitation for persons to participate, whether as stakeholders seeking care or those providing it, and yet we're seeing an increase, then where does this call to action lie? What is actually our state of awareness and our opportunities within it? So here I just have a little timeline extending from 2011 all the way up to 2025, when the PM, Prime Minister again, Dr. Drew, also reiterated the need for prevention and early detection when it comes to malignant neoplasms. So the objective was similar as this. We did a test research combination mixed methods approach to getting a 15-year history of the awareness and action activities that are relevant to the cancer care stakeholders with regard to capacity and awareness in St. Kitts. So we systematically convened and sampled a lot of publications, including press releases and media, and that includes social media as well. We selected publications, and I use this with air quotes, as well as different sources to review. And of course, we wanted to look at the databases that exist, because one of the things that we wanted to understand is St. Kitts keeping pace with the level and the frames of research around cancer, or are we just depending on proxies for our Caribbean neighbors? And so we use the appropriate keywords to execute this. Our results were such that we found almost 150 different pieces to look at across publications, report, media, articles, and repositories. And we chose at random and convenience 40 to evaluate. We looked at the Caribbean region and we found a lot of references to different forms of response and calls to action, but specifically, three of them were references, five were emerging, focused on emerging novel detection and techniques, kind of which some of the earlier speakers spoke to, as well as our keynote and featured address presenters, international research consortia, and of course, multiple concerns, and within that 43 concerns about care in times of crisis. And it's exclusive. The reason it doesn't add up to 40 is because some of them were a little less easy to characterize. But specifically for Sloan Kids, we looked at media outreach and screening procedures and plans for treatment, as well as plans for a national registry. I know which is also a shared burden for the rest of the Caribbean in that even if they do exist, and they don't always, even if they do exist, we don't always have the most comprehensive, up-to-date data. And also, I had to really focus on the fact that a lot of the contents of this particular profile, when it comes to awareness, was unfortunately a bit sensationalist, alarmist, or on the other side, aspirational and biased according to cancer type, and actually heavily leaning not on the public clinical sector, but leveraging the private sector, a lot of community-based organizations, much like the one I'm a founder and principal investigator for, as well as local businesses, and I'll talk a little bit more about that. And the treatment and registries, again, there was very much few to no evidence that they were actualized or materialized in the 15-year span that we were looking at, while we're calling for more resources and attention to action. We're growing cancer care. Continuing, we kind of again looked at themes to categorize these findings. And so regional research collaborations, it remains from a formal point of view, slow but well-intentioned. I think not a lot of the nations and territories were included within the scope or collaborated with St. Kitts, which is, I think, a missed opportunity. And many of the researchers are actually medical trainees and or professionals or affiliates or affiliated health centers, which is good because you have technical expertise, but we're missing some of the key stakeholders that are part of the community that are very integral to cancer care, getting the deserved attention, etc. Additionally, and perhaps the most challenging and glaring was that there were a lot of, let's just call it pats on the back in the media about the delivery of care in St. Kitts Nevis. And although I can acknowledge that there has been strides made, a lot of it is that the CASADEC investigation and I guess subsequent intervention into why travel remains necessary, it became very apparent in that there's just so much, even preliminary cancer care serving and cancer detecting procedures that are absent, unfortunately, now to an NFL elevation. And again, even though it's more aspirational, educational awareness campaigns tend to lean toward, it is still unfortunate that you can call to action, but then it's like, you'd ring a ding a bell and there's nothing on the table. And so a lot of persons, stakeholders who are unfortunately survivors of cancer and or battling the disease find themselves informed, but not necessarily able to actually do anything actionable. A brief aside again with the results is that the bias is also part of the problem. We understand that proportionally speaking, breast and prostate and cervical cancers are the top ones. But again, in our 15 years, like spot checks, we found that, the cancers of the dermis, cancers of lungs, other types of cancers were underfeatured, if at all, ever mentioned, although according to the little bit of probes that we did previously, we found out that those actual incidences are on the rise as well. And so we really need to, especially because cancers, neoplasms that are malignant tend to metastasize, we can't just silo cancer care awareness and response. So where does that leave us? Saying it at the record with the fact that it has a low research publication, and I'm not somebody who think that's like a metric per se for like successful intervention, or even a successful individual. But we have to do a little bit more investigation and dedicate resources to doing that. We also have to acknowledge that our rate, even though it's not limited to intellectual interest and resources alone, that is part of the constraint. A big part of this is that the community groups are a big part of the support and response. These charity foundations and public health agencies do a lot of official work, but the community support groups in cancer care have been very integral in not only making sure awareness is accessible to the layman or the average person, but also a lot of times subsidizing the cost of travel for persons. Information so thus has to be repurposed or repackaged in a very intentional way that's less varied and confusing and overwhelming and even contradictory, which we found in a few instances. And then as well, we have to be mindful of the cultural and specific social determinants that other persons mentioned. Our use of tobacco and drinking. I can say one of the contradictions I observed and experienced myself is that there was a fundraising walk for, I think, breast cancer by one of the groups. And after that, persons were like drinking alcohol and consuming processed meats, which are precursors if you know anything about it. But it's not all bad. Our findings suggest that even though we're well intentioned and fragmented in our response, and we have issues of limitation and stymie in our education slash awareness detection and response, we can definitely serve ourselves in action and opportunity and use the opportunities to collaborate with persons in the region and beyond the region, have more multi-sectoral involvement to pursue and analyze data. Again, the registries, I think, will be a big head start or at least a catching up for St. Kitts and Nevis when it comes to doing so, and whether we have to do that to patient records, interviews, and engagement professionals, which has already been happening. Hopefully, we can accelerate that in a way that's impactful. And then finally, we could, definitely increase and consider the effects of disease surveillance when it comes to responses, making them more viable, but also think a little globally. I'll always put environmental aspects into climate change being a big qualified barrier to health access. We saw, no shortage of issues when it came to drought as well as floods and hurricane when our health access decreased individually and collectively in some communities because of these unfortunate impacts. None of this work would be possible not only without my contributors and the Straws program, but also I want to shout out the support groups that are in St. Kitts, Pink Lily Cancer Care in Nevis specifically, and the two in St. Kitts, Large Island, Essence of Hope, and Breast Cancer Foundation. Support from Reach for Recovery. All three of these are doing phenomenal work, and even though it's only one type of cancer, because of its in higher incidence and higher visibility, they have made it a personal and professional mission in a way that is very inspiring to me. And I will commit now on this call, whether it matters or not, to make sure they get additional financial and material resources to do a lot of the good work that they're doing, sometimes in consultation with physicians as well as with the open support of the government, which continues to call for action, but is not necessarily the best position or resource to do that. That's the end of my talk. If you have any questions, comments, feel free to chime in. Thank you for your time.
Right. Right. So wonderful, Dr. Whittaker. I'm really happy and excited to see this presentation. I was only aware of it from afar, but seeing it here today is really great. We have almost time for like half a question because unfortunately, this must be rapid fire and this is a whole, a bit longer than expected. But is there any burning questions in that chat I can ask, take a really quick clarification question if needed? There's a hand up. Go ahead.
Good afternoon. In
Very
terms
quickly, yeah.
of public awareness in schools in St. Kitts and Nevis, can you give a feedback on that if there is any?
Sorry, could you repeat your question? I didn't hear the first part.
Public awareness for the school population. Can you give an update if there is any?
Great question. I'm not necessarily best person to ask from my own conversations. I can say that's a missed opportunity to go into the schools and make it part of their health curriculum, such as health curriculums exist. I'm actually working on a way to make health and family life, at least doing a auditing of it, a little bit more reflective and connected to real life challenges. And it includes morbidity and mortality from specific diseases. But your point is well taken. I do think the actual organizations, some of them that I mentioned, want to do that and tend to try to do that. But a lot of these persons working tirelessly are doing with little resources, and it's not their 9 to 5. They're doing it after hours and on weekends, and that unfortunately makes the alignment with schedules academically a little challenging. But that's definitely something I would recommend to my partners going forward. Thank you.
Okay. So unfortunately, we don't have any more time for questions, but I appreciate this work, and I think we need to see more publications coming out in Kits and Nevis.